The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us today. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Chemthorne Motors, and, of course, our technical producer, J.D. DeAngelis, who's back from vacation, or were you back last week? I don't remember. This morning in the studio with me is Nancy Warmby, Executive Vice President of the Medicine Center Pharmacies. And joining us from Mercy Medical Center are our very special guests, Dustin Shetler and Mary Duffield from Mercy's Pulmonary Function. A little later in the program, Joel Porquez will join us from Mercy Sleep Center. And thank you for coming to the studio this morning, guys, and welcome to the show.
Thank you.
Thank you. Excited to be here.
So, E-Cigs, vapes, Juuls, hot topics these days. They're popular among teens, and you can see some interesting and enticing videos on social media, but they're not necessarily popular among parents. Today, we're going to learn more about whether they're safer than cigarettes, talk about the flavored juices, and find out more about the risks and consequences of those items. We'd like to remind our listeners that today's program is also available on our podcast, which can be downloaded from the App Store on your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions during today's program, we invite you to post them on our live Facebook feed, or you can call the studio at 330-450-1480.
So, Dustin and Mary, tell us a little bit about yourselves and what you do at Mercy Medical Center.
Well, I wear a couple hats. I work in the pulmonary rehab. So there I help people with chronic lung disease exercise. And then I also work in the tobacco cessation program.
And I work in the pulmonary function lab. We do basically the pulmonary function testing on patients that are ordered. We have a big array of different tests that we do. So we're actually looking at how their lungs are working.
So we're here today to talk about e-cigarettes, vaping, et cetera, et cetera. What exactly are they, and how do they work?
Well, an e-cigarette is an electronic device. Basically, there's three parts to it. You have the liquid part to it that contains the nicotine and propylene glycol, which is the primary liquid that's in it. You have the atomizer, the heating coil, and then you have a charger. So whenever somebody uses this, they either press a button, or some of them are self-actuated. When you inhale, it lights up, it heats the plate, and then turns the liquid into a vapor. And then people get the nicotine that way.
So people are still getting nicotine with these devices, I guess it's a device, and tar through these so-called e-cigs. Is it the same amount as regular cigarettes?
Well, they don't exactly get tar. They do get nicotine, and they have found some other cancerous chemicals in them. So I would just warn against that. We really can't promote them as a smoking cessation tool. There hasn't been enough studies, and we don't know the long-term health effects of these e-cigarettes. So when people come to me asking about them, whether they can use them as a smoking cessation tool, I really encourage them to do the traditional forms of quitting, like nicotine replacement therapy and some of the other medications out there.
So it's interesting that the propylene glycol is the vehicle.
Yeah, that's found in asthma inhalers.
Yes.
Because that's the liquid that we put into our model trains that makes smoke. And we were talking about this prior to the program, that I was at an outdoor restaurant last week, and there was an individual using one of these devices, and every time she whiffed off of it, it just sent up a cloud like the place was on fire. And everybody looked around like, what's going on? Because the people sitting on the other side, you just couldn't see what was going on. And it was sort of like from the kitchen area, So
yeah, through the different generations, they've increased the amount of vapor that they can produce through the heat. And the more you heat this, the more bad things we found. So you can find actually formaldehyde in it. If it heats too much, you're inhaling heavy metals. And a recent study from Johns Hopkins showed they're inhaling lead too from it.
Fabulous.
Oh, yes.
So,
Okay. So can we vape, as it's called, without nicotine and tar?
right now, it's hard to say that because none of this is submitted to the FDA for testing. So whenever you buy the liquid, there's usually the ingredients we would have to send to a lab to say that there's no nicotine in it. And actually, some of the stuff that has been tested saying that there's no nicotine in it, they've actually found scant amounts of nicotine in that.
So basically, the game plan here with these devices is to continue the people being hooked on the nicotine.
Sure.
Is that
Sure.
about
That's
the
correct.
simplicity? That's
Yes.
about the
Mm-hmm.
way.
Yeah, and it's, go ahead, Mary.
Unfortunately, adolescents are using these, and so now we have adolescents that are now addicted to the nicotine. So now we have a whole generation that's coming up addicted to the nicotine. So where we were making headway and getting people to stop smoking, now we got a whole new generation moving up that is basically smoking again.
I know over the years there's been this controversy about actual addiction to nicotine. True or false?
True. Nicotine, actually, when you look at it, and we see it coming from like the American Thoracic Society and even the FDA, that nicotine is one of the most addictive drugs out there. It's not as dangerous as, like heroin,
Sure.
but it's still one of the most addictive drugs out there. Does everybody that smokes a cigarette get addicted to the nicotine? No. Not everybody does, but those that do, it's an extreme, it's hard for them to break that because it's not a habit, it's an addiction.
So, how long have these products been in the marketplace? I kind of lost the time frame here.
Since about 2012.
That's when
even
the popular,
before then.
it got popular,
Right.
2009, something
Yes.
like that.
So we don't really have any history on lung cancer or
Right.
No.
that sort of
Not a lot of long-term
was,
studies.
There was a study out, I'm thinking in 2014 or 2015, where they were looking at the effects on the flow rates through the lungs, which we watch for obstructive pulmonary disease. And they were showing that there was a decline in the main flow rate, so the airflow through the large airways was declining. So,
and the industry continues to grow dramatically, is my sense on this.
yes.
Right.
Can we throw a question in
Sure.
there about secondhand smoke too? We know with traditional cigarettes how dangerous secondhand smoke can be to the people around them. Do we know
Right.
anything yet about the secondhand smoke from vaping?
Unfortunately, I don't know a lot about it because there hasn't been a whole lot of studies, but people can absorb nicotine that way. I can say that. But unfortunately, I don't know exactly.
I don't know. I think in some instances that if somebody who has, say, like asthma is around somebody and they vape around them and they inhale that, it could very well cause bronchospasms in that asthmatic person. So,
Okay, so what about vaping without nicotine? And you just alluded to the fact that there were other chemicals, potentially in these products. And we also talked before the program about all the different kind of flavors now that they're the whole thing is just completely crazy to me. I might drink some orange juice or something.
Right. So some of the ones without nicotine, I'm worried more about the flavorings that they put in them too. They're finding diacetyl in these, and that's causing popcorn lung, which might sound harmless, but
what's popcorn lung?
Bronchiolitis obliterans. So what it's doing is scarring the gas exchange unit in the lung, the alveoli. It causes scarring around that, which makes it unable to absorb oxygen as well.
Is that,
Right.
is that why you call it popcorn? Or?
It's called, good question, it's called popcorn lung because workers in a popcorn factory use this chemical to flavor the popcorn.
Fabulous.
So they were around it, and they actually stopped adding it because so many workers were getting this
Well,
condition.
I know there was some issues with microwave popcorn. That some chemical something. Is that what we're talking about here?
Yes, okay. The same one.
And it kind of died away. It was a big fuss there for a while, but they kind of hushed it up, I guess.
Yes, because they stopped putting it in because so many people had issues with it.
So microwave popcorn is now safe?
It is. I believe microwave popcorn is good and safe.
All right. You're up, Nancy.
Okay. So if people are using e-cigarettes or vaping to quit smoking, can they control the amount of nicotine in tar and gradually wean themselves off?
There are different levels of it, these manufacturers claim. So you can do a step-down program of it, but like I said, it's the variability in the amounts of nicotine that they put in. It's hard for me to say to back up their consistency with that. So
I see it, and I think of basically when you look at now what the FDA is doing to all the cigarette manufacturers and companies. Now they are mandating that they decrease the nicotine levels in those cigarettes. So then are they going to start regulating these to get the nicotine levels down also? So.
I thought that was in the process of growing the tobacco.
The nicotine that they put in is a byproduct of it's tobacco derived. So it's not a.
They can't make it chemically. They're getting it off of tobacco.
Exactly.
Okay.
Yeah.
Yes.
All right.
So the little cartridges, I think, are just kind of like little tubes with the liquid in them.
Yes. Yep. And a lot of them are refillable. So a user has the device and can put in an amount of nicotine in them. That's kind of scary, and there's been a lot of poison control calls from children ingesting this liquid that the users have sitting around. So 0.1 milligrams per kilogram of a child, the nicotine can be poisonous per 0.1 milligram of nicotine per kilogram of body weight. So in one of those little vials, there's potentially 10 times the amount to poison a child with.
Oh dear.
And it's happened before.
Is this an expensive habit?
It's actually a little bit less than traditional cigarettes.
In New York City, it's $12 a pack, and I don't know, so I'm hearing.
Right.
There it might be a little bit less expensive, but
yes.
So I don't know what they cost on that.
It ranges. It ranges a lot. Some of them, a starter kit will be $20. Some of them, a starter kit will be $100.
Yeah.
So,
okay, first break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties, a locally owned Health Mart pharmacy. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of ostomy and diabetic supplies and compression socks. All of our pharmacies carry a variety of canes, walkers, bath seats, rollators, and commodes, all at super low prices. Our rollators are only $69.95. Call or stop by our local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Spring has sprung at Studio Arts and Glass with our annual Garden Art Show, June 8th and 9th. Local artists fill studio with pottery, jewelry, blown glass. Watch our craftsmen create beautiful stained glass windows or make a succulent live wreath. Call to reserve your space today or just come in for the Killer La Pizzeria Brownies. That's Friday, June 8th and 9th from 9 to 8 p.m. Studio Arts and Glass in North Canton on 77 and Apple Grove.
Allergy season is here. That means itchy, watery eyes, nasal congestion, and sneezing for people who suffer from allergies. Whether you're looking for an antihistamine or an all-natural remedy like Allercom, which has been proven to help manage allergic and asthmatic symptoms in both children and adults, our Medicine Center pharmacists can help you find relief from your allergies. The Medicine Center pharmacies are located in Canton, Louisville, Minerva, and New Philadelphia. The Medicine Center Pharmacy, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. The pulmonary experts from Mercy Medical Center are in the studio today. And we're talking about e-cigarettes, vapes, e-juices, and more. Have a question, give us a call at 330-450-1480 or post your question on our live Facebook feed.
So I guess the next burning question, no pun there, guys.
Yeah, are they on fire?
It's happened before.
I know, that's what I've heard.
So in your opinion, are e-cigarettes a safe and effective way to quit smoking?
No.
Yes, I
think
would.
so.
I would advise somebody. Okay, so if that's the only way somebody's going to try, I will run with it. But most of the time, it doesn't work, and it leads to dual use, or we're just exchanging one bad
Cigarettes
habit
and
for
vaping
another.
at the same time.
Right?
Yes,
Exactly.
I love it.
So I would push more towards a traditional way of smoking. The varenicline right now, Chantix, has a 32% chance of helping people quit in 6 months. So that's really good success rate.
Mm-hmm.
So I would steer somebody more towards that. The electronic cigarettes, we just don't know the long-term health effects, so it's a little bit scary what we've heard.
And is smoking cessation something that you help with at Mercy?
Yes, certainly. We have a program there that sees people as outpatients. We try to talk to everybody that's an inpatient as well. We do group counseling, so individual counseling as well. You can call us on the phone. Our number is 330-430-6963, and also the pulmonary rehab number 330-489-1270.
Good job.
Yes. Trying to remember. I was practicing that.
Well, you know what? Cell phone use, I think, has gotten all of us to the point where we forget the phone numbers we used to remember.
You know what? Everyone has a computer. Look us up on the web.
Yeah.
So that's easy to do.
Fabulous. So I know that you're here also today to talk to us about pulmonary rehab.
Yes. So our pulmonary rehab program, the patient experiences 3 different phases. We have the first phase where they come in, we do an assessment, and we do make up a care plan. We do a lot of education with them. Then the second phase, I call it boot camp. So they come in, we get them in the exercise classes. We do up to 36 classes with them, depending if the insurance covers that much. That's where we set some goals and help them achieve their goals with physical activity, because a lot of shortness of breath comes not just from the lung disease, but from deconditioned muscles. So if we can condition those muscles, a lot of people it'll help their shortness of breath.
Oh.
And then the phase 3 is just a way for them to continue. So it's like a gym membership. After they get through the boot camp, they can keep it up. We're open 5 days a week for that. So, but not a lot of facilities offer that. So, Thank you, Mercy.
Okay. Well, we are thrilled to have Mercy Medical Center. They'll be offering free pulmonary function testing at several of our Medicine Center pharmacy locations on a quarterly basis. Mary, what exactly is a pulmonary function test?
Pulmonary function test is basically a way for us to see how well the lungs are functioning. It looks at the different aspects of the lungs. The air flows through the airways, so it looks for any obstructions or restrictions to the airflows. We look at the total lung volumes, and are they in the right proportion to each other? So one of the big things with a lot of the COPD patients is, do they trap air in their lungs? Some patients do, And one of the tests that we do can tell us how much air is left in the lungs at the end of an exhalation. So we all have air in our lungs that we never exhale, but it's should be.
Is that a bad thing, or?
No, we all have, it's called a residual volume, so that air is always in our lungs, so basically that's what keeps our lungs inflated.
I see.
But some of our COPD patients trap air in their lungs, so the air gets through the airways, but it can't get back out again. So then their chest can get distended, and that. So we test to see how much air is left in the lungs at the end of exhalation. So if they're trapping a lot of air, then the physicians know.
Does the body use that trapped air? Does it pull oxygen from that trapped air?
No, it can actually build up in the system, and if they get too much trapped air, then they can actually, it causes a rise in the carbon dioxide because they can't get rid of that carbon dioxide.
I see.
So, but we check to see how well the oxygen that they're breathing in is absorbed by the body, basically. So that's pretty much it. We do some specialty testing too, but so.
So who might benefit from pulmonary function testing?
Really, we do a lot. People, if they're having shortness of breath, their physicians may send them in to see if there's something going on with them. Anybody with chronic obstructive pulmonary disease, we like to get those PFTs on them. We normally do them actually before they go in and start into pulmonary rehab. So we see a lot of the patients that are going into rehab and that. So
is this something that's on the rise in our communities?
Yes, the third leading cause of death in adults is COPD.
Right.
And not a lot of money is being put towards helping prevent this. So our program really helps halt the disease progression of COPD. It's unfortunately, those numbers on the pulmonary function test are never going to get better. Might a little bit if they stop smoking. They're actively smoking, they stop. But to help them, we do the exercise, and that seems to help with the shortness of breath and quality of life.
And
so
we also see patients who have a form of restrictive lung disease, which is like pulmonary fibrosis or pulmonary hypertension. We test those also.
Okay. Just as a reminder, pulmonary screenings will be held in Canton and Louisville pharmacies, Medicine Center pharmacies, in July, along with A1C. Next time they will be held will be in October. So it is time for our second break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist Brad White from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
The The summer driving season's here, and it's the perfect time to shop the largest auto mall in Northeast Ohio with one click at Kempthorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz, and Sprinter, too. Something for everyone's price range. Kempthorne.com makes shopping easy, fun, and friendly. We also have a huge selection of pre-owned vehicles, and less than stellar credit is never a problem. The Kempthorne family name's one you know and trust. Committed to our community for over 80 years. Shop Kempthorne.com.
Spring has sprung at Studio Arts and Glass with our annual Garden Art Show, June 8th and 9th. Local artists fill studio with pottery, jewelry, blown glass. Watch our craftsmen create beautiful stained glass windows or make a succulent live wreath. Call to reserve your space today or just come in for the Killer La Pizzeria Brownies. That's Friday, June 8th and 9th from 9 to 8 p.m. Studio Arts and Glass in North Canton on 77 and Apple Grove.
Hi, Paul White for the Medicine Center Pharmacies. If you had chickenpox, you are at risk for shingles. Shingrix, the new vaccine for shingles, is now in our pharmacies. Did you already get the other shot? Shingrix is more effective, and you will need to get a 2-shot regimen. Talk to your Medicine Center pharmacist and learn more about this new injection. The Medicine Center Pharmacies at Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. See us on MedShopRx.com. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. We're now talking with Joel Porquez from Mercy Sleep Center, who has joined us. And welcome, Joel. Can you take a moment and introduce yourself?
Well, thanks for having me. My name is Joel Porquez, and I am the clinical manager for the Mercy Medical Sleep Centers.
So, we understand that sleep apnea can impact not only sleep, but it may impact everything from our blood pressure to our acid reflux. What is sleep apnea, Joel, and what symptoms generally trigger a discussion with your family physician?
Well, basically, sleep apnea, sleep is an interesting topic in itself because everyone has a funny or horrific story when it comes in terms of sleep. But basically, in simplest terms...
You're not going to talk about dreams today.
No, we're not. That's a different conversation.
Okay, all right.
But basically, when it comes to sleep apnea, is any interruption in your breathing while asleep. And that is repetitive. And it's usually the bed partner that says, get the elbow in the side and it says, honey, breathe. Or stop snoring and roll over, because sleep apnea can be positional. And it can be sleep stage related. So... in terms of blood pressure, I think more often than not, people and patients that have sleep apnea have high blood pressure. Because if oxygen levels tend to decrease, where your airway closes, and oxygen levels drop, then it puts a tremendous stress on your cardiovascular system. And therefore, that repetitive, what we study in the sleep lab is how often does this closing or partial closing of your airway occur. And we get that index per hour, and then depending on how often that occurs, you can imagine the stress that it puts on the heart. In terms of the acid reflux, again, it's one of those things that most people that have sleep apnea would have acid reflux. Depending on who you talk to, depending on the research, one would say that the gastric acids actually irritate the vocal cords, thus causing the airway to close. Or it could be also just the changing of the pressure, or the airway, the sudden gasping that causes such reflux. So, I think on the short end is that those on CPAP, which is one of the non-invasive treatments for obstructive sleep apnea, their acid reflux is no longer present.
Well, why is that? Well, what does it do?
Well, now, when CPAP stands for continuous positive airway pressure, because obviously with sleep apnea, your airway is closing partially or completely. So CPAP is a device that is filtered room air that you wear a mask, either over your nose or over your nose and your mouth, that there is a certain pressure that we will increase in the sleep lab that will open your airway Therefore, regardless of sleep position and sleep stage, your sleep is now continuous. And you're no longer arousing, getting up, go to the bathroom. You sleep continuous because most often than not, sleep apnea occurs when one sleeps on their back.
Okay, makes sense, I guess. Huh?
Another bed partner might say, or someone that witnesses someone sleep, that, I cannot sleep on my back, or I have to sleep on 3 or 4 pillows. Or someone might hear that I can only sleep in a recliner, because now your head is more elevated, you're not as horizontal, therefore your airway is not going to be due to gravity too. Because getting to some of these questions that that are commonly asked, hereditary, things like that, it does depend on the size of your airway.
Okay. What about weight loss? Is it not true that obese people are more commonly known to have apnea?
That's true. It's obesity is a risk factor, as just as the size of your airway, if it's this narrow airway and so forth. So I always say this tongue in cheek: a cheap and dirty way to find out. And even in the sleep labs, it's not uncommon to measure the patient's neck. So one would say for men, and if your neck is 17 inches or greater, then it's a likely quick measurement of what gives us an idea of what you possibly could have sleep apnea, or the size of your airway. For women, 17 inches or greater. 16 inches or greater. So it does, so that's like
so everybody out in the audience is not going to run out there and measure their neck.
Right. Well, you can imagine like football players who are athletes with huge necks.
Oh, yeah.
I mean, they have sleep apnea. So they have...
No kidding.
Right. And so there's a lot of things that what makes sleep very interesting, that we could feel a lot more than
never heard the neck thing before. That's very interesting. God.
Right. So if one would lose weight, therefore it would decrease the chances of the airway collapsing, partially or completely.
Yes,
your airway is now open. If your oxygen level should be 90% and above. We've had patients in the sleep lab drop in the 40s or 50s.
Oh, gee.
They don't even the sad thing is they don't even realize it.
Wow, no kidding. Well, wouldn't they be kind of breathless or?
Oh, yeah. That's why it could go silent. You hear snoring, it goes silent. They wake up with a gasp, a snort. Again, like I mentioned, the elbow to the side by the bed partner that says, "Honey, breathe." So it's all manifested.
Well, the finger test oxygen level in your, I forget what they call the device, and
the pulse ox.
Pulse oximeter. And when they first came out, they were very expensive. They used them in the hospitals first, and then they showed up in the pharmacies, and they were like $200, several years ago. Well, now they're down to like $20, so a lot of people are buying them. So I want to try this. So, I got one out the other day, put it on my fingers, and it was 98 or something like that. I don't know. Is that the normal person, or?
Well, exactly. So you want to we get a baseline of what your oxygen levels would be at rest. Okay. And yes, so you should be, for adult, it should be more than 90, 95 and above.
Yeah. Okay.
But in general, 90, because once you're relaxed, your oxygen levels might drop slightly. Okay. But in general, it should be greater than 90%.
Okay.
Medicare guidelines that we follow to add oxygen would be less than 88% for 5 minutes.
Wow.
So that's one of the criteria that physicians will follow.
To prescribe oxygen.
Mm-hmm.
Wow. Okay. Do you diagnose other than sleep apnea, other conditions?
There are, yes, there are a lot of parasomnias out there, and some would say 70, some would say close to 100, but obstructive sleep apnea is the most common. There is such things as insomnia, difficulty falling asleep, and it's not just difficulty falling asleep, it's also difficulty maintaining sleep, because patients can say, "Joel, I can't fall asleep. I can easily fall asleep, but then I wake up a lot."
Well, I ran into a fellow many years ago who never went to bed. I mean, he could not sleep for more than 20 minutes. So he would sit up in his lazy boy chair all night. He'd sleep for 20 minutes, and then he'd wake up for an hour or two, and he'd carve. He was a wood carver. That's how. And this was way back, and of course televisions went off at midnight. You know, there was nothing to watch.
Right.
So he would do a little reading, but he could carve canes. So he had, when he died, he had a boatload of these wooden canes, all fancy carved up.
Well, he made good use of his time then.
That he did when he couldn't sleep, but he could only sleep a maximum 20 minutes.
Right. Well, the body will get what it needs, and it will get the REM sleep, is where one of the deepest stages of sleep. And that's where I alluded to the fact that that sometimes once we open the patient's airway, we see the patients go immediately into REM sleep. Because obviously, if your airway is closing partially or completely repetitively, you're not getting the deep sleep that you want or need.
Explain the sleep. REM, the other types of sleep.
So that deep stage of sleep is one where we process our memory. So one of the complaints to your family physician might be that I have short-term memory loss. You know, so smoking that we just talked about earlier is a risk factor. But deep stages of sleep. So REM is where we lose muscle tone. It's actually when our brain is awake and our body is essentially paralyzed. This is why I mentioned that sleep apnea can be stage related. So not only most common on your back, we see it in the sleep lab once you hit sleep stage REM, and it's the rapid eye movements that most people are accustomed to. And unfortunately, those that have sleep apnea do not get the proper amounts of REM that they need.
I see. Okay. Our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com. Allergy season is here. That means itchy, watery eyes, nasal congestion, and sneezing for people who suffer from allergies. Whether you're looking for an antihistamine or an all-natural remedy like Allercom, which has been proven to help manage allergic and asthmatic symptoms in both children and adults, our Medicine Center pharmacists can help you find relief from your allergies. The Medicine Center pharmacies are located in Canton, Louisville, Minerva, and New Philadelphia. The Medicine Center Pharmacy, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. We've been talking about E-Cigs this morning, and now in the afternoon, or later in the show, we're talking with Joel Porquez from Mercy Sleep Center. So let's get back to the final portion of the show.
Okay, so I think we need to talk a little bit about sleep studies. Can you tell us when they're prescribed and if insurance covers them, and what our patients can expect when they have one done?
Sure. So once you have brought the similar signs and symptoms of sleep apnea, which would be, doc, I have difficulty falling asleep. The most common one is my wife tells me, I don't know why I'm here. My wife tells me I snore. You know, we hear anything from morning headaches to wake up with a dry mouth, short-term memory loss that I mentioned earlier. So once the physician sees the need, there are several tests that can be done. One is, the polysomnogram, which is we hook you up to all the wires, and then we see if you have sleep apnea or not. I think a big confusion right now is that what insurance, Mercy does accept all insurances, and we, even being a healing ministry, we do accommodate that where those that need financial assistance can apply for the needs if they need it. But people, there's a big confusion with, well, I had my sleep study at home and I had my sleep study in the lab, and which one is better? So I think if I may, there is such thing as a home sleep study. Mm-hmm. It is limited channels. You don't have all the electrodes on your head or measuring your brain waves. So it basically goes on respiratory and pulse ox, measuring your oxygen. It is only to be used as a screening tool for sleep apnea. Oh. And that's the key. It is driven by physician preference, and by insurance because it's cheaper. When you come into the sleep lab and we hook you up to these electrodes till we see your brain waves, you have something underneath your nose which increases sensitivity. If you stop breathing, it measures the airflow, any partial closing of your airway. We have two belts, one over your chest and one over your tummy, that the technologist will place on. Pulse ox, we measure your heart. We put electrodes on your legs. So explaining all those things in lab, there are more disorders that we could pick up, mm-hmm. especially if one tells us they cannot sleep well because they have a medical history of, say, epilepsy, so we can actually pick that up in the sleep lab.
So you come into the sleep lab, you have all the electrodes on, belts. Can you actually go to sleep?
That's probably the number one question we always get, or reaction is...
I mean, you can't roll around, lay on your side or anything. You got to lay flat.
No, you can roll over, All right, okay. That's the funny thing, because there's no way I'm going to sleep with that stuff on me. But I kind of, in the back of my mind, is like, we've been doing sleep labs for a very long time. Eventually, you will go to sleep. So the technologists, my staff is trained, and I admire my staff, and they work very hard to accommodate, because for the mere fact that our patients that come in, what's one of the signs and symptoms if you're not sleeping well? You're moody, you're irritable, you're grumpy, they don't want to be here, it's not their own bed. So we're already against all odds when they walk through that door. Mm-hmm. So I have a very good staff that's very accommodating to your needs. And
so, what are you looking for during that testing period?
So if it's a screening period, whether you have sleep apnea or not, we are looking at your brain waves. Your brain waves will be scored during the day. after the day after your study, and we will see the different stages of sleep, see if you're getting the appropriate amount. If there is something suspicious like epileptiform-like activity, we do bring that to the neurologist's attention. Breathing, if they do stop breathing in their sleep, we look at oxygen levels, and then we look at their heart. So we had the heart and their body movement, because you are going to be recorded on video. So your behavior is big too, because it's one of the other sleep disorders out there. And then we correlate all of that. So once we know that you're asleep, because sometimes we get comments by patients that says, "I didn't sleep a wink."
No.
But we know by your brain waves, you actually slept 6 hours.
Interesting.
See? So it's what one perceives as sleep. Does one perceive sleep if I'm only dreaming, or if it's interesting how everyone has their own individual thoughts about sleep. So we do correlate. If you did stop breathing, we might see the heart rate start to slow down. We might start to see the oxygen levels from 90 go down to 88, 86, 84 to 70. I've scored an obstructive event that lasted 73 seconds the other day.
Wow.
So you essentially stop breathing for over almost 2 minutes.
Gee.
Can you imagine that?
How interesting.
And then here comes the or you just change body positions, or you just go to the bathroom, or I like that whole elbow in the side, honey, breathe.
Oh, interesting. Gosh. Okay. Tell us a little bit more about your technologists at the sleep center.
So as I mentioned, so they do work hard to accommodate your needs. So there are rooms are set up to be as homey as possible. Obviously it's not going to be exactly
you got snacks in there and all that kind of stuff.
We can offer a few snacks. We can, no chocolate,
no alcohol.
No, unfortunately no. But
well, red wine's supposed to help you sleep, isn't it?
Well, that's a whole different conversation there too, pal. Because alcohol, the misnomer is yes, it does help you fall asleep,
Sure.
but then you have to go to the bathroom in a few hours later, which you wake up.
Yeah.
So it becomes disruptive. But a technologist will help accommodate. If you need a fan, we have a fan. Need an extra blanket. Help explain things. Try different masks if you're there for the second night to get the CPAP study. Make you feel as comfortable as possible. So
how long is it? How long is the sleep study?
We usually tell patients to arrive around 8:30. Okay. After the introductions, and we make you comfortable, and the placing of electrodes can take anywhere from 30 minutes to an hour. Okay. And then you fall asleep. But then there's those patients that say, "I can't fall asleep because the Cavs are playing tonight."
Yeah.
And I'm like, "Well, you're here for a sleep study. Your insurance approved you for today. Let's
You're in trouble.
Let's go ahead and get this done." We try to get at least 6 hours of recording time or sleep time. Now, if you're for the second night to possibly try the CPAP to open your airway, the earlier you can sleep, the more data we will have, and the longer time the technologist will have to increase pressures to assist you to open your airway. Then we have all the data that's later interpreted by my day staff and me, and then we give it to the physician. If you are severe, we bring it to the physician's attention right away, and then hopefully get you treated appropriately.
Amazing. Okay. I know some people that have sleep apnea, and one of their biggest complaints is dry mouth.
Yes.
And we have a lot of dry mouth products in our store. And I will use one of those on occasion because of the meds I take, okay?
Right.
And the one I really like is the one that, I can't think of the name, sort of sticks to your tongue. Say again?
Xylitol?
No, well, it has xylitol in it. They all have xylitol in them, okay? Biotine and, all those other guys. So, is that safe to use those?
Personally,
when you sleep. Okay.
Personally, I have no experience with the medications in dealing with dry mouth, because the most common reason why patients would have dry mouth if they have sleep apnea is because they're sleeping with their mouth open. They might be mouth breathers.
Okay, not because of the device.
Not because of the device. Because now, that's the first part. Waking up with a dry mouth, they're excessive snoring, loud, And then if it's due to the CPAP, that's why there is humidification with water, distilled water, and then you can actually control the humidification. You can turn up the temperature to help assist you with a dry mouth, which is supposed to simulate your sinuses.
We're out of time. Sorry,
we're out of time.
We need more time.
Yeah.
Okay, we always need more time. Thank you very much to Dustin Shetler, Mary Duffield, and Joel Porquez from Mercy Medical Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors today, Mercy Medical Center, Studio Arts and Glass, Kempthorne Motors, and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy, caring for you and about you. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.
The preceding program was sponsored by the Medicine Center Pharmacies.